Good morning, and I want to thank the organizers for inviting me for this talk. And my topic is on the impact of flash glucose monitoring on glycemic control and healthcare consumption in patients with type 1 diabetes. And it's a nationwide cohort study done in Israel. We all know that despite significant improvement in diabetes management, type 1 is associated with increased mortality. There's a high percentage of patients with poor glycemic control. And we know that there's a strong correlation in type 1 patients between the frequency of self-monitoring of blood glucose and glycemic control, the frequency of hypoglycemia, and of diabetic ketoacidosis. And I want to mention here an important study published in 2014 in the New England Journal of Medicine from the Swedish Registry of Diabetes. This National Diabetes Registry was after January 1998. And in this study, they took for each type 1 patients 5 controls that were randomly selected from the general population and matched according to age, sex, and county. The patients and the control were followed until December 2011 through the Swedish registry for cause-specific mortality. And what we can see here is the hazard ratio for death from any cause or from cardiovascular cause. And we can see in all the hazard ratio of 2.8, 4.2, a much higher, an increased rate of death, and even higher for female from cardiovascular cause, which are numbers of 6, 7, much higher numbers. And if we look on the A1C, we can see that the higher A1C, the higher the risk of all-cause deaths and deaths from cardiovascular death, and it is increasing a lot in the higher A1C results. In the year 218, 4 years ago, the Israeli Health Basket approved the use of Libre flash technology for all patients with type 1 diabetes. That means that they can purchase it for free. It is recognized by the Health Basket. And we wanted to evaluate what was the impact of this flash continuous glucose monitoring, the introduction of this technology on type 1 diabetes glycemic control and healthcare burden in a large real-world cohort of new users of flash glucose monitoring technology. And this was published in Diabetes Metabolism Research and Review by the worker of the, by those who did the work in 2020. So what was the method? It was a non-interventional retrospective study that utilized de-identified data from the central computerized database of Clalit Health Services, which is the largest HMO in Israel, which comprise more than 4 million patients. And we took all Clalit members that were age 18 years or above, that had type 1 diabetes, and that initiated the Freestyle Libre after its introduction during the year of 2018. The index date was defined as the first date of purchase of the Libre sensor, and our calculations were done specifically, individually to each patient from before the index date, before they used it, to after the index date. We included patients that were 18 years and or more, that were at least member of the Clalit at least 6 months prior to the index date, and at least 6 months following the index date. That means 6 months of purchase at least for the Libre. Subjects were included if the average sensor purchase was less than 1 sensor per month, which is consistent with a minimum of 50% adherence. How did we assess the outcome? We looked for the change in hemoglobin A1C from baseline to the first measurement that was done at least 3 months following the commencement of the flash technology. And we looked also to the rate of internal medicine hospitalization from 6 months prior to the index date until the end of the study. Additional endpoints were change in rate of glucose test strips purchase, the change in number of A1C tests that were performed during this time, the change of diabetes-related healthcare visits, and the change in hospitalization for DKA and severe hypoglycemia from the time of purchase to the end of the study. What were the results? So we started with more than 5,000 patients with type 1 diabetes, and that started the flash glucose continuous monitoring during 2018. 1,600 patients were excluded either because they didn't have 6 months membership prior to the commencement of the Libre, or 6 months following it, or 700 were excluded because they had less than 50% purchase. And we were left with almost 3,500 patients for our analysis. For the analysis of reduction of the A1C, another 800 were excluded because they didn't have either A1C prior to the commencement of the Libre or 3 months or more after the commencement. So for the analysis of the A1C was done on 2,600 patients. The median follow-up was of 14%, 14 months, sorry. The baseline characteristics are shown in this slide, and we can see that 50% were age 45 years or older. And we can see also, which is typical to type 1, we had 50% of our patients that had a BMI up to 25, and only 14% that were above 30, which is above 30 is a usual value that we see for type 2 patients. What about the A1C? Here we have a lot with high A1C. We have 22% that had an A1C above 9, and only 23% that had an A1C below 7. We had, what was a change of A1C from baseline to first follow-up by subgroup? So for the whole population, the change was from 8.1 to 7.9, which was significant, but it's a question how clinically significant is this reduction. What were the groups, subgroups that reduced more the A1C? Younger age was associated with a higher reduction, lower socioeconomic status, those who purchased glucose strips below the median had a higher reduction, those with A1C above 8, those on MDI compared to those on insulin pump. And We defined as a significant improvement those who declined by their A1C by more than equal or more to 0.5% versus those who had a lower decline in A1C. And what were the predictors? So as before, lower age, as lower socioeconomic status, higher A1C, those who were on MDI, and those who purchased less strips than the median purchase. When we put everything into a multivariate analysis to see what were the independent predictors, we were left only with age, younger age, and with a higher A1C. That means that, for example, people who purchased less strips than the average, it was not an independent subgroup. They are associated with a higher A1C, and the higher A1C is associated with is a better predictor, is a predictor for lower, for a good response for this technology. When we looked on the change of A1C during our follow-up, we can see the initial reduction from 8.1 to 7.9 that was stable and did not increase, but continued to be with a lower A1C until the end of the study. And here it's 15 months of follow-up. We looked also to see that it was not by chance the initial reduction in A1C. We looked for 6 months prior and 6 to 12 months prior, and the mean A1C was 8.1, like in the beginning of our study. So it was definitely related to the start of the Libre. What about healthcare consumption? So we can see here that primary healthcare visit decreased by 19, almost 20%. And we were surprised to see that also visits to the diabetes and endocrine specialist declined also almost by 30%. The number of A1C measurements were declined as well. What about hospitalization? There was a 44% decrease in hospital admission for DKA and a 43% decline of admission for hypoglycemia. Definitely very high decrease of hospital admissions. So in conclusion, among our 2,600 patients with an A1C that were measured both at baseline and 3 months after the initial purchase of the Libre, the average A1C declined from 8.1 to 7.1 at the first measurement. This decline was maintained during follow-up for up to 15 months. Patients with baseline A1C above 8 declined from 9.3 to 8.8, a significant decrease at the first measurement, and 8.7 at the last measurement, which when the follow-up, median follow-up was 13 months. Definitely a significant decline. A clinical significant reduction of A1C of more than 0.5 was experienced, I didn't show it before, but it is in the data that was presented, was experienced by 25% of the patients. And in multivariate analysis, younger age and higher A1C were independently associated with a clinically significant improvement. And we saw a decreased consumption of healthcare services in all the domains that we checked. These results, or most of the results, were found also in other studies that were published before and after this study. And thank you very much. And I'm open now for questions. Thank you.